Carly is the former Chief Quality Officer at TennCare. She has over 11 years of deep hands-on experience inside Tennessee's Medicaid agency, where she led the development of TennCare's comprehensive quality strategy. She oversaw MCOs and spearheaded landmark programs, including Tennessee HealthLink and multi-payer patient-centered medical home. I've had the pleasure of participating in Carly's webinar. You are in for quite a treat today, as, as it is both highly informative and you have actionable takeaways. Carly, I'll hand it over to you.
Thanks, Kristen. As Kristen said, my name is Carly Campbell, and one of the top things that I'm hearing about around the country right now in healthcare is these rural health transformation funds that are going out. And so I put this together as just a quick um, primer on what's going on, and I think hoping it'll be helpful for you as you're navigating this space. We ask that everyone share their organization and state in the chat because I'm really just interested to know what states you all are from. You may be from an organization that operates in a lot of states, but one thing that um, is very true about the Rural Health Transformation Funds is that every single state is doing this differently. And so there are 50 different unique approaches to rural health transformation, and um, I'm going to dive into a few examples, but really what matters most is the state that you're operating in. So the main goals of our time together. First, I just want to help you understand what rural health transformation is and how it's structured. I have pulled a few examples from Tennessee, Georgia, Indiana. I have not memorized all 50 different applications and rural health transformation projects. But I am looking at a variety of states, partnering with organizations to help them understand those states. And these are just a few that I am familiar with, but really every state is unique. And then I just want to make sure that you walk away from the webinar today with very specific ideas of how you can be a part of this, or if you want to be a part of it. So this all started in last July when the Big Beautiful Bill passed. Part of that was funding this rural health transformation. And what it's what it was set out to do is spend $50 billion over 5 years to support rural health across the country. So every one of the 50 states applied for funding, and all 50 of them received their awards. That was at the very end of last year. And what's important is it's not just a bunch of money going to the states, it's very tailored, and every state had to submit their plans to get it approved. And CMS is going to be overseeing this all along the way. So funds that don't get spent will get put back into the overall budget and perhaps get reallocated to other states. Um, 5 years sounds like a long time, but it's moving very quickly. This slide is just to show you how the money is distributed amongst the states. Half of it was just split equally amongst the states, and the other half was distributed based on a bunch of different factors that CMS put out there. Ultimately, what that translated to was that every state is getting about $200 million in this first year. You can see at the bottom of this slide, they ranged from 147 million to 281 million, but most of the states are kind of hovering right around that 200 million in the first year. So CMS has identified these five goals as sort of the lens that they took to evaluate the state plans. And they're also asking the states to use these five goals to evaluate their applications within their state. So you're going to see these themes throughout the presentation and also throughout your own research if you decide to apply for rural health transformation funds. Really, chronic disease prevention, anything that's upstream in prevention is certainly a priority. Sustainability is important. CMS has indicated that they're not wanting to fund things that are going to have fall off a cliff after 5 years, but instead things that were going to outlive the grant cycle. Um, there are known workforce shortages in rural America, and so anything that specifically targets recruitment and retention of rural providers and targeting specific shortages, that's also been listed as the goal. Technology and innovation, as we all know, technology is rapidly changing, and there are ways to use technology to our advantage to support um, those people that live in rural areas and may have limited access to traditional health care. And then value-based care, value-based payment models are a piece of this as well. Certain states have prioritized this more than others, but generally innovative payment models that prioritize quality or bundled payments, things like that, have been a theme throughout this. So this slide, I think, is helpful if you are an organization really interested in applying for rural health funds in your state. Um, I'll start with the big one, which is the cap on direct patient care. Um, so only 15% of a state's total award can go to direct patient care. And that what that means is that the vast majority of the money, 85%, is going to be flowing through uh, system transformation. So like workforce pipeline, technology infrastructure, redesigning your care model. So it's not meant to supplement your overall operating budget. It's actually investment capital for building something new. And so I would say providers who frame their proposals around transformation rather than reimbursement are going to be the ones who get funded. Next on here is the infrastructure cap. This one comes up a lot, and the nuance really matters here. Um, the bright line is that you cannot use RHTP dollars for new construction. You cannot build a new hospital or a new clinic or a new wing onto your building, um, or buy a building, but you can use the funds to supplement construction or cause, things that um, maybe are building operations or renovations that are clearly tied to your program goals. So I'll give you a practical example. Let's say it's an FQHC that wants to co-locate behavioral health services in their clinic. Maybe they have an unused storage room or a space that could be reconfigured. They could convert that space into a counseling suite, maybe add a partition or upgrade the HVAC system for soundproofing or just installing the right equipment. That is uh, costs that are linked to the program goal, which is behavioral health integration. And so that would be allowable as long as it's not more than 20% of the total cost of the project. Um, so what you couldn't do would be to build a standalone behavioral health wing on the side of your building, because that would be crossing over into expansion. Um, Georgia actually, their application had 75 million dollars in infrastructure investments, but it was all targeted at things like grid resilience, water and air quality assessments, storm preparedness upgrades to their existing facilities. So those are investments in things that are already there and not building something new. And one thing I'll say is that equipment purchases usually do fall into this cap too. So things like exam chairs or dental equipment or diagnostic tools, as long as they're tied to program goals, they are fully allowable um, into that 20%. The third cap, which is the 10% cap for Tech Catalyst Fund, this is a little different than the other two. CMS built a specific carve out for a program that they're calling the Rural Tech Catalyst Fund Initiative. And it allows states to dedicate up to 10% of their annual award to test and scale consumer-facing, technology-driven solutions. So we're talking about things like chronic disease management apps, remote diagnostic tools, maybe AI powered workflow solutions, things that where the technology puts um, something directly in the patient's or the provider's hands. So the way that this works is that a, a provider might partner with a vendor who has experience running this technology, and the state would vet that to decide what the best one is. Um, what I'll say is, for context, is that this is a relatively small piece of the pie. It's designed for really targeted, innovative bets, but not the core part of the transformation. So it's just a specific funding lane to be aware of if you are interested in partnering with a technology vendor. Um, Another thing that's important on this slide is the third bullet point there. The year one funds actually need to be spent by September of 2027. So these grants that the states are putting out now are going to be really time constricted. They are just now being released. Some have already put their RFPs out. Some are just trickling them out starting now. But my sense is that they're trying to get the funds assigned and obligated by late summer, early fall, and give a full 12 months for organizations to spend the dollars. So it is important to know that funds that don't get spent will get clawed back by CMS. So this is all happening quickly, and the the better prepared you are to spend the funds, I think the more successful you will be. So next, I'll just go towards some things that I've seen in my research. As I mentioned, I haven't read all 50 applications, but I have exposure to quite a few, and these are the themes that I've seen in what CMS has approved states to use the dollars for. A lot of states are allocating money towards behavioral health integration and maternal and child health. Those are areas that we know there are gaps for rural Americans where there might not be a lot of OBs in the rural area, or there might be a high behavioral health need and a workforce shortage. There's also, in that same vein, a lot of funding going towards telehealth and remote patient monitoring to help rural Americans access healthcare and value-based care transition, with the AHEAD model coming out. And I'll get to this with my Georgia example. There are ways to use these funds to help primary care and hospitals get ready for value-based care that's coming down the pipe. So I have chosen three states to focus on just to give you some specific examples. But the real takeaway here is for you to focus on your own state and what the way it's structured in your state, and what your state officials have released as far as what they're looking for. So I'm based here in Tennessee. I'm based in Nashville, and this is one that I wanted to focus on. Um, they are putting their funds into five priority areas: care access, maternal health, prevention, health technology, and workforce. So organizations applying need to really tie their goals to at least one of these five priority areas. And they will be giving up to 100 grants out over the course of this. They haven't started releasing those grants yet, but I expect those to be coming very soon. They've held two webinars already, and they're posting the webinars and the slides up on their websites if you've missed them and you want to check it out. They did indicate in the webinars that they're really looking for models that are sustainable. So they will give extra points in their scoring to projects that really illustrate how they're going to sustain the transformation after the 5 years. And they don't want organizations to just use the funds to hire a bunch of people that are going to have to get fired. So think about that and I think a lot of states are prioritizing sustainability, but it really came out loud and clear when I was attending those webinars from the Tennessee folks. Um, I'll give maybe an example. For me, specific examples are really helpful when we talk about these broad stroke initiatives. So I'll give an example of maybe an application that could work in Tennessee. One would be like a critical access hospital in Tennessee. Maybe the county that it's serving does not have any safety net dental providers. Um, and it's been designated as a dental health professional shortage area. So this hospital, they already have primary care on site. And so they already have like a billing infrastructure with Medicaid and community trust, but their patients don't have anywhere to go for dental care. So the hospital could apply for rural health transformation funds to really build out two dental operatories within their existing clinical space. And they could ask for these funds to cover things like the chairs, the x-ray units, sterilization, maybe some minor renovation to convert some underutilized exam rooms. They could use the funds to help recruit and retain dentists and hygienists and staff training on dental billing and care coordination. Here's why I feel like that kind of proposal could work. The costs are almost entirely one-time stand-up costs. Um, the dental program would bill TennCare, so there's a or private insurance. So there's a sustainability plan after the grant ends, and there's no ongoing dependence on the grant dollars. But that stand-up cost is significant and something that maybe has been a barrier for the hospital to take on this approach. And they've identified why it's needed because there is a dental shortage area in their in the counties that they're serving. So that's just an example from Tennessee. The next state is Georgia. This state, they received about 219 million for their year one. Their lead agency is their Georgia Department of Community of Health, which is their Medicaid agency. And they have really focused a lot of their funds on getting Georgia ready for value-based care, specifically preparing providers for the AHEAD model, which some states are in the AHEAD model and not all states are. But because their state is, there's a lot of focus on that, which makes sense. Um, so an example, I think maybe from Georgia that could work would be a small rural hospital that wants to create a regional telehealth hub to connect patients with behavioral health, maybe OBGYN consultations, chronic disease management. And if so, they could ask for funds to pay for things like the telehealth platform, maybe some of the remote monitoring tools, hiring and training their care coordinators. Um, they would need to really frame the care coordinators as time limited roles that are part of launching the new program. And then, any upfront costs in partnering with urban specialists, maybe even costs for data and tracking data systems to ensure that their program is improving the lives and outcomes of these individuals. And Georgia really explicitly prioritizes projects that expand access through telehealth and coordinated care. So that's why I feel like this is an example that could work there. They really do um, spend a lot of time in their application talking about telehealth and specialty access. The next state example I have is Indiana. Theirs is pretty different. Well, they got 207 million in their first year. Their Department of Health is their lead agency. Um, I highlighted this one because it's unique in that they have divided the state into rural regions, and they're calling them regional hubs or coalitions. And each hub, now that it has just recently been established, who are part of those hubs will be distributing the funds. So it's really important in Indiana that applicants are hyper local, really tuned in to what the needs are of that community. They have community needs assessments available for each of the regions. And so the applicants must reference those community needs that were identified in the needs assessment, as the rationale for their projects. They have a lot of information publicly available on their website about who's serving on those regional coalitions, but it is important that organizations have to apply through their regional hubs. There is not a blanket application for the state like there are in other places. So just relationships on the ground with Indiana is essential for this one. And I think they're going to really prioritize Indiana-based applicants as much as possible. So just as a recap, these are three states that I highlighted, and they're all roughly getting similar amounts of funds, but they have different models of how they're going to be funding them, individual grants or regional coalitions. Uh, Indiana has already released a timeline, but the others have not. The others have just said late spring or applications coming soon. So really the best way to stay on top of that is for any state that you're interested in to get on their mailing list. And it doesn't take that many clicks once you've Google, your state and rural health transformation funds. A lot of them do have mailing lists, and they will be pushing out notices when their applications go live. Not every state has this, but a lot of them do. And I have found that to be the easiest way to stay on top of which applications are available. So now that I've gone through the state examples, I did just kind of want to overall say how this is going to be changing the landscape going forward. Anytime you pump billions of dollars into the system, there are inevitably changes to the way healthcare works. And I think one is this value-based care adoption is going to be accelerating because there are states that are really prioritizing this. And it was emphasized in the CMS overall goals as well. Really, a lot of emphasis on partnerships and provider types working together. Uh, I think that there's a reluctance to give money just to a standalone rural clinic to do a project, and rather to have a really collaborative initiative that involves even urban providers that are helping to support rural Americans. So, the more collaboration and cross-sector applications, I think, are going to be more successful. And I think that's really going to be one way this changes the landscape. Also, a real big investment in workforce. We all know that there are healthcare workforce shortages, especially in rural areas. And so there is an intention for this fund to help train, recruit, and retain a workforce that supports that population, whether that workforce is actually living there or not. Definitely having the workforce to support them. And then certainly technology is a part of this, but also accountability. CMS is requiring that all the states regularly report on outcomes and expenditures to really demonstrate that the funds are going to the priorities that they've outlined. So if you're on this webinar, you're probably asking yourself, okay, so where do I fit into this big set of initiatives going on? And I tried to summarize it in a few different ways that you could plug in. One is really joining your state's advisory groups. They're called something different in each state, whether it's a stakeholder council or advisory committee or steering group. But and some of them are still open to seats at the table. Some of them have already closed, but again, that's really on a state by state basis, and not every state is doing it the same way. But there is interest in getting real on the ground experience in shaping how this will work. The most obvious way is to actually apply for a competitive award. And that's what's listed here as number two, either applying directly or joining up with a partnership to apply for an award under one of these grants. Another way to plug into this work is to really help with the workforce development in on the downstream to try to um, maybe being part of that clinical team that hires or supervises CHWs, for example. And then one thing I'll say about policy and sustainability, this is a 5-year initiative, but right now the grants that are being put out there are for year one. So it will definitely take different shape over the next 5 years in which projects demonstrate improvements and are actually able to successfully use the funds. So I think staying abreast of that in your state in particular and how this will evolve over the next 5 years is important. So practically speaking, what can you do to make sure you're prepared for this? As I have mentioned, every state has submitted a detailed application, and those are publicly available. At the very end of this webinar, actually, right here is a hyperlink at the bottom of this page that links to all 50 state applications. If you just walk away from this webinar with one thing, it's that hyperlink because you can go there and review the applications of all 50 states and really understand what the priorities are of your state. I would take the time to read that project narrative and understand what provider types are eligible in your state for applying. And also take the time to understand who your state's lead agency is. It the Medicaid agency? Is it the Department of Health? Is it some governor's council? And then typically that's where you would find the mailing list that you could sign up for or webinars. It's going to be hosted by that lead agency. So just starting with reading the application is really where you need to start. And from there, trying to get as much information as you can from the lead agency. Once you've read the application, what I would suggest is really reflecting on what your organization does for the community. Which rural communities do you serve? Where is your impact the greatest? What are your strongest existing partnerships in your community and ask them what they're thinking about rural health transformation and if they might want to partner on an innovative idea. They may be looking for a partner, or you may be able to recruit them as a partner for your idea. Also, make sure that you're reviewing any data that the state has put out about the community needs assessments. Some states have done a really good job of this, or any like patterns about what rural health needs there are in your state. And then taking time to see where the strengths of what your organization does meets those gaps and meets the where that aligns with the priorities that were outlined in your state's application. As a next step, what I would do is step back even further and reflect on the 5 CMS strategic goals. In most cases, those are going to be very similar to the strategic goals that your state put out. But really think about if you were to take on this innovative project that you have in mind, how could you demonstrate outcomes? What could you measure? This is often a really challenging part, especially to measure and demonstrate outcomes in 1 year is challenging. But what is it possible to measure, and what investments might you need to be able to measure this accurately and efficiently? Also, be thinking about sustainability past the 5 years because that's going to make your application stronger and also your initiative stronger. Um, my other suggestion would be to make sure that you're framing your project as a true transformation, um, not just doing the same thing you're doing now, but with a different pot of money, but really transforming what you're doing now in a way that will lead to a system change. It could be something that you were planning to do anyway, but you didn't have the available funding to pull it off. That actually is a great position if you're in it because you've already done some of the planning and the thinking. You just really need the funds to actually execute. So, if that's where you're you're already ahead of the game. And I can't emphasize enough that sustainability is really a major scoring criterion. So again, I think it's very important to really engage with your state and any kind of coalitions or councils that they've brought together. Um, as you're thinking about partners in your community, think about your state hospital association, your state's primary care association, or whichever associations that really reflect your organization, and ask them how they're gearing up for rural health transformation. They may be putting organizations together for applications, and you want to make sure you're part of that. Um, when possible, volunteer to be on part of these advisory committees because you'll find out information more accurately and quickly that way, and you'll be able to influence, how the funds are used. So this is maybe just a high level application checklist. The timelines are different for every state. Overall, the timeline is that the first year funds have to get spent by October of 2027. So as you can imagine, every state is scrambling right now to get their funding out the door. But the exact timeline of they're going to release an application on May 1st and it's going to be due on June 1st, every state is different on what those deadlines are. So that's the first thing. You really need to check on what the timeline is for your state and what um, implementation milestones there are. I spoke earlier in this webinar about some allowable and non-allowable costs, but I would make sure to look really carefully at how it's framed by your state, because you don't want to submit an application that's sort of dismissed altogether because you are using the funds for something that is not allowable. So make sure you pay careful attention to that. And make sure you use any kind of data that you have available to demonstrate the need. The states and CMS are wanting to solve real problems that are out there. Um, when you can demonstrate, hey, we really do have a dental shortage in our area, and here's the data to prove that. Or we have more patients with chronic diabetes than our partnering counties, and we need these kind of um, remote patient monitoring equipment for this reason. Things like that are going to make your application more compelling and successful, and really just demonstrate the need. Again, on the right side, I just sort of put a reminder on some of the major things that are not allowable across the board, but each state is going to kind of spell that out in their own specific way. This line at the bottom, I mentioned it before, but I'll say it again. The states are really under pressure to spend this money quickly. And so organizations that are ready to go and ready to spend the funding are going to do the best job. Ready to go, as in they have a really good idea that's already well formed. Maybe they've even started some of the components of that idea. Those are the kind of things that I think are going to really bode well in the application process. So this is my five-step action plan for you. First, read your state's application, understand your community, your partnerships, especially in the community. Think about where you can add value and how your program can be sustainable. And then engage with those partners and with the state agencies that are running the RHTP. And then it's time to apply. Get your budget together, get your application together. If the applications haven't been released yet in many states, you just need to start with steps 1 through 4. And by the time you're done with that, the application will probably be out because they are just more and more coming out each week. So what I want to do now is just take a moment for if there's any questions, but also want to share with you this last slide I have, which is resources. Feel free to take a screenshot of this, but also we can share the slides with you. I have my email address on here if anybody has specific questions to me or want to partner with me about your own particular state application. These websites are good resources for anybody who's looking for legitimate information about the Rural Health Transformation Project. And but the main website that you really need to do is your own state's website. That's where you're going to find the most relevant information for the projects that you might want to apply for. And that's why I put that at the bottom. Read your state's application this week. It is the single best thing you can do to get started and engage other people on your team to think, how would you use this money? What could you use it for? Um, get everybody brainstorming. It's kind of a fun thing to do. If you were granted new money to help the rural communities in your area, how would you use it? The states have to spend it quickly, so they're looking for good ideas. And I think that a lot of organizations that apply will get funded. States are hoping to spend all of the money that they've been allocated because it will get taken back if it's not. Let me just pause there and turn it to Kristen to see if there were any questions that came through the chat.
So Carly, no questions that came through the chat, but some people are excited that we'll be sending out the your slides after the presentation. But we can take a moment and open it up to see if anyone has questions now that they'd like to ask you.
Yes, hello. My name is Prakash Rajgopalan. I have 30 plus years of management consulting experience, all of them with the state and local governments, significantly all of them with KPMG. And I recently, 2 years ago, retired. I'm in my post-retirement advisory gig at this point. So I would be very happy and grateful to connect with the new folks on this call. I already know Sarah Rodriguez quite well because we worked closely together in the past. And if there's any way I can help out in any opportunities that you might have, please feel free to reach out as well.
Thank you.
Wonderful. Thank you.
One thing I'll add, when I've been talking to organizations, they often ask me, well, how big is the grant? Is it worth it for me to put an application together? How much money am I going to get? The truth is it varies a lot. And, in Tennessee, for example, an organization really needs to put the budget together based on what they think it will cost to carry out or to execute the idea that they have. And that may dictate the size of the grant that they get. So there are some limits, but it could be $1 million, it could be $5 million, it could be $300,000. So the size of the grant is really, and this is dependent on the state too, but it's more about what is the initiative you're trying to carry out and how can you demonstrate what that would cost.
And Carly, one question that I had as you were going over everything and from anything you've researched or anything you've heard and your roles and experiences, will states take a viewpoint of looking to provide grants to only provider agencies or hospitals or anyone that is based solely in that state, or will they be looking at giving out grants to providers that cover several states?
This varies a lot. I mean, I know, for example, I've seen states that specifically call out vendors as eligible applicants. So it doesn't have to be a healthcare provider that is applying and receiving the funds. It's more about what is the project and the outcome. So it could be a technology vendor that is um, receiving the funds in partnership with a provider group uh, to accomplish the goal of increasing telehealth access for maternal fetal medicine specialists, right? The money does not have to go specifically just to providers and hospitals.
Which is great to know. So this is a wide-ranging opportunity for lots of people to make the changes they've been thinking about for a while and help improve the system.
That's right. And as I said earlier, I really think those collaborative applications are going to be the most successful. So that may be a collaboration between some hospitals, providers, and a vendor, right? And they all put together a proposal of how they're going to work together to strengthen um, the rural health framework in their region. There are a lot of states that are talking about using this money to build or strengthen their HIEs, for example, health information exchanges, because that's often an area that has challenging funding setup. So, that's an example of a project that's not really directly provider facing.
Thank you. Any other questions for Carly? Carly, we appreciate all this information and the expertise you've provided here today. We will, as I said, we will send out the PowerPoint slides to everyone and they know how to reach you and us if they have additional questions. So we just appreciate everyone participating today. And there was another comment, Carly, that said, great presentation. Thank you. Insightful presentation. So again, we thank you for your time and this information that you've shared with us, and we will get these sent out. We hope everyone has a great rest of your day.
Thanks, everyone.